deep compared to the previous one, GA, because this one is rheumatoid nodule. And how to differentiate these two? First thing is deeper, but not always relies on whether it's deeper or not. But rheumatoid nodule, we call this red granuloma because you can see inside is really red. Because inside this granuloma, you should not find mucin deposition. Inside this thing, we call this red material that is, I think that this material is the fibrin, causing this one because kind of necrosis, because of this granuloma, they do not have enough oxygen, and then the fibrin just go out from the blood vessel or maybe the side dying. So we can see this is the fibrin deposition. So you cannot see this bluish, whitish space inside this granuloma, but you always want to check because epithelioid sarcoma can always look identical, like this rheumatoid nodule. So you need to go high power to check this cell are truly histiocyte. No pleomorphism, not really prominent nucleoli, make you think of any neoplasm. But if you have any doubts, you are always welcome to do like some histiocyte marker CD68, and then you can also do cytokeratin. If you can see cytokeratin here, kind of highly suspicious, it may be just not rheumatoid nodule because rheumatoid nodule is to be histiocyte. And then of course we can do INI1 because we know epithelioid sarcoma will have loss of INI1. Then it can also help you because you never want to miss an epithelioid carcinoma. And then you call this rheumatoid nodule, it will be really, really, really bad. The third one for the differential diagnosis, also low power, we can also see kind of this, again, another polycytic granuloma pattern. But this one, I think it's really easy to pick diagnosis because the material inside is dramatically different than the previous two. Because this is gout, we just have this needle-shaped crystal inside. I don't have any other thing to say because when you low high power, you see this feathery crystal, needle-shaped crystal inside. That should be gout. Okay, and then the last one for this polycytic granuloma, this is epithelioid sarcoma. So you can see this lesion stay really deep into the subcutaneous fat. Then we can also see something kind of mimic a rheumatoid nodule, kind of look like polycytic granuloma. So as again, I mentioned, we need to go to high power to see something inside, not just fibrin deposition, everything just that. This is true necrosis of the cell, not just like fibrin deposition. Then we can see really atypical cell, really huge pleomorphism, prominent nucleoli here, like here. So the cell kind of pleomorphic. This should not be just histiocyte. Honestly, there are some histiocyte around. It's normal, but when you see this pleomorphism, prominent nucleoli, necrosis in the middle, don't forget our epithelioid sarcoma. I think it should be rare, but you need to always bear in mind when you see this polycytic granuloma pattern.